Hi, my name's Neil Peterson from Brigham Young University, and I'm one of the co-chairs for Exercises Medicine on campus. We frequently get questions about how to achieve a higher level in exercises medicine on campus. For example, we get the question, how can a campus with a large virtual population hope to achieve gold or even silver level status? So when a campus has a large virtual population, leveraging your online resources and presence will benefit you as you strive for silver and gold level status. Physical activity related promotion and education material can be shared through campus social media, websites, blogs, podcasts, radio, and newspapers. And those are all ways to reach students who are off campus. Social media in particular is useful in attracting and maintaining engagement with students, both on and off campus. There are some excellent examples from the University of North Carolina and Michigan Tech University. They have both published what they did during COVID in the Translational Journal for ACSM and ACSM Health and Fitness Journal. They showed how they adapted their physical activity program delivery during COVID to reach virtual participants during that time. Another question we get are, what are some ways we can work toward reaching gold level status on a campus that does not have an active health center? There's a few different ways that you can achieve this. First of all, most campuses have some sort of on-campus center for students' health. It could be for mental health, like a counseling and psychological services center, or some sort of physical health center that's not a standalone health center with typical providers and nurses on staff. You can work with those well-being centers to help reach your gold level status. And many campuses that don't have an on-campus health center may have an off-campus affiliate healthcare clinic. And you can work with those clinics to help achieve your gold level status. A good example of this is actually with my co-chair, Lisa Leininger, at California State University, Monterey Bay, where they do not have an on-campus healthcare clinic, but theirs is off-campus. Another category of questions that we get are on how to collect data and do research on their exercises medicine programs. So what are some effective evaluation strategies for your EIM programs? There's a few different ways that you can do this. First of all, when implementing your activities, you can do pre and post intervention surveys. You can do some health metrics monitoring. You can look at academic performance data. When working with students and volunteers and others who are engaged with making your activities happen, you can do focus groups and interviews with them to get both qualitative and quantitative data on how things are going in implementing those activities. Another thing that is underutilized, but I think is something that can be an important tool in evaluating how effective our programs are, is working with our partners and other collaborators and assessing how effective those partnerships are. What ways could we be improving in collaborating? What do our stakeholders want? What can we give them? And what are we looking for? What can they provide to us? And so doing an assessment of your partnership and your collaboration is another way you can evaluate the effectiveness of your EIM programs. Another question we get is, can you provide some insight, details, or suggestions regarding types of EIM-OC related publications and appropriate venues for dissemination? The EIM Research Learning Collaborative is an initiative that brings together peers to learn, share, and apply best practices from the academic research community, combined with the wisdom of frontline community service partners. The EIM Research Learning Collaborative also seeks to track all EIM-OC related publications, and so you can learn more by navigating to the Research Learning Collaborative website. One venue to consider when sharing your EIM research is through one of the many ACSM journals, such as Medicine and Science and Sports and Exercise, or the translational journal of the American College of Sports Medicine. The translational journal of ACSM announced this October 2024 that they are striving to become the premier destination for EIM-related research. They are actively soliciting research that follows the EIM vision, which is to make physical activity assessment and promotion a standard in clinical care. They seek manuscripts that assess the EIM vision on a systemic, social, and individual level. Generally speaking, the EIM section is looking for implementation and impact papers. When doing interdisciplinary research, work with your collaborators on appropriate discipline-specific journals and other venues that might be interested in exercises medicine. For example, I am a nurse researcher. Publishing EIM material in nursing journals helps spread the word about EIM programming to audiences who otherwise are not exposed to the great work that we do here in exercises medicine.